Today, KW Property Management and Consulting has partnered with Becker Law and Broward Health to share COVID-19 best practices in community associations. The coronavirus has board members and world leaders focused on containing this highly contagious virus. In the past 2 weeks, the coronavirus has become the top news story worldwide. Over the next hour, our panel of experts will educate and discuss what actions we can all take as leaders to mitigate the impact and spreading of COVID-19 throughout our communities. You are all volunteers and you are leaders in your communities. Unfortunately, that doesn't make any of us experts when dealing with an unprecedented pandemic. Our panelists today will help provide direction and guidance for handling some tough decisions that we will all have to make. Let me start by thanking our 3 panelists today for taking the time to participate on this webinar. I can assure you all 3 of our experts are extremely busy addressing the coronavirus in their respective lines of business. So let's meet our panelists. First, I'd like to welcome Dr. Josh Lenkus. Dr. Lenkus is the Chief Medical Officer of Broward Medical Health Center. He is board certified in internal medicine and previously served as Chief of Staff at Jackson Memorial Hospital. Dr. Lenkus is an author of several medical publications, and he can often be heard on radio and television addressing medical concerns in our community. Welcome, Dr. Lenkus.
Thank you.
Donna Berger is a shareholder in Becker's Community Association practice in Fort Lauderdale. Donna represents all types and sizes of community associations throughout Florida. Donna has been a proactive source of information addressing the coronavirus, and we are delighted to have you with us today, Donna.
Thanks, Tim.
Finally, Catalina Cruz has been with KW Property Management and Consulting for more than 15 years. Catalina is a partner, and she serves as the company's Managing Director of Operations. KWPMC is most proud of Catalina for recently being named one of the South Florida Business Journal's top 25 influential businesswomen. Kat, thanks to you for all you're doing to keep our staff and associations informed on this growing concern. We have had an overwhelming number of registrants sign up for today's webinar. Many of you listening today sent us questions. We will do our very best to answer those questions so you can tackle some of the tougher decisions that you face within your community associations. Since we have just 1 hour today, let's jump right into our questions. And let me start with Dr. Lenkus. Doctor, can you tell us exactly what is a coronavirus and how did this start?
Yeah, thanks very much, Tim, for having me this afternoon. A coronavirus is nothing new. In fact, the coronavirus is an umbrella that's used to expand or explore 7 different viruses that we are aware of. This was first diagnosed in the 1960s. 4 of the coronaviruses we're well aware of because they happen to people, typically giving them the cold-like symptoms that we're accustomed to. 3 newer coronaviruses have since come to light in the last 20 years. In 2003, the severe acute respiratory syndrome, or SARS syndrome, was diagnosed. And then in 2012, the Middle Eastern Respiratory Syndrome was diagnosed, or MERS. This coronavirus, COVID-19, was first diagnosed in December of 2019 in Hubei province in China, in Wuhan, China, in a wet market, which is where animals are sold alive, slaughtered there, and then served to people to eat. The 3 coronaviruses that I mentioned over the last 20 years all have origins in bats. So it is entirely possible that someone in that wet market had purchased and ate an infected bat, was infected, him or herself, and then that began the transmission process.
Because we often hear, oh, it's the flu, but it seems like it's more severe. So what are the differences?
I missed the first part of your question, but I think we're trying to get to the differences between flu and coronavirus. Unfortunately, we are still in flu season, which complicates things a great deal because many of the symptoms that someone would have suffering from the flu are mirrored in the coronavirus. But the main symptoms that we see in patients suffering from the coronavirus are fever, cough, shortness of breath, and then there's a small percentage of people that in fact their presenting symptom is diarrhea. So those are the 4 symptoms that we're really looking at. The CDC at this point is guiding us in the first 3, which are really respiratory in nature, in addition to that fever.
And the fact that it's respiratory, what is the most common way for this virus to be spread?
So great question. If you're around someone that's coughing or sneezing, I mean, for eons, we've told people to cover their mouth. It is never more important than it is right now. If somebody does cough or sneeze, it's that those aerosolized droplets that carry that virus that then can spread to someone else who is not equally protected.
And then how close do you think we realistically are as far as finding a cure for this? The funny thing about this virus is that every day we hear new information and we all pivot one way or the other as we hear new information. So yesterday I heard, well, there's a malaria cure from years and years ago. Like, what is realistic from a vaccine that could be offered to help kind of curtail what's going on today?
Yeah, so using the guidance that we have when treating patients with the flu, we use a vaccine in the preventive phase, in addition to some community efforts like washing your hands and covering your cough. But we also try to those people that are ultimately affected with the flu, we do have antiviral medications that can slow the progression of that, make your symptoms less, or speed up the resolution of it. Using that same rationale, there are efforts underway to try to create a vaccine to coronavirus and to repurpose other drugs that are already out on the global market for different uses in an effort to try to damp down the symptoms of the coronavirus. What you mentioned in terms of the anti-malarial, that is one of several drugs that are currently being looked at to see if those will minimize the symptoms that folks have. But I got to tell you, a vaccine, even though we just enrolled the first patient in a vaccine trial, a vaccine commercialization is at least 12 months away. So we can't wait for a vaccine to be developed in this country.
Terrific. We all look forward to that. But until that vaccine is ready, we've heard about flattening the curve or social distancing. So can you tell us a little bit about what good that can do to help us try to mitigate the spread of the virus?
Yeah, absolutely. What we see is a tremendous peak up in terms of patients that would get infected and their positive test results. If you look at the examples that we have in China and in Italy, there's this tremendous surge of folks that are infected. What we're trying to do is we're trying to flatten that curve. Instead of making it this huge mountain peak, if we make it just a small hill, it's much easier for the healthcare system to absorb patients as they need our resources. In fact, if you think about it, a great analogy somebody pointed out to me last week was, if you were suffering from a cold and you were a family of 4, would it be better to wipe out the whole family all at once? Or would it be better to be able to take care of your family if one person had it after another? At the end result is the same. 4 people are still get the illness, but it's much easier to take care of your family if you're only taking care of one family member at a time. And that's kind of what we're talking about when we talk about flattening the curve. The ways that we can do that are by things like social distancing. And what you've seen in the last week is you've seen bars and restaurants and theaters close, stores close around the country, sports venues are closed, large gatherings. We know somebody who is infected there who does not take the proper precautions in covering their own cough or sneezing can rapidly infect a large number of people. So social distancing means no more handshakes, no hugs, really staying away from people, giving a 6-foot distance. All of those large gatherings, eating in restaurants, those kinds of things now are passé. We have to really avoid those in order to damp down that curve.
Terrific. So what do you consider? You shared with us yesterday that you live in an HOA. And so you understand the business that we're in and what we're trying to address with everybody when they come home from work. And now many people are home and quarantined as they try to work from home. So what do you see as the primary risk for community associations relative to the coronavirus?
For community associations like who your clients are, really the community pool, the clubhouse, any congregation that includes more than about 10 people is ripe for an infection. So many institutions around the country have begun limiting the hours closing them, limiting the number of people that can use those congregating places all at one time. It's still okay, by the way, and encouraged to get outside. I mean, you can get out and get fresh air, walk around the neighborhood. You can go to places that have tennis courts or pools. You could still go there, although I wouldn't bring 50 of my closest friends to have a pool party. So it's still okay to be outside. It's just you have to limit the number of people that are together all at one time and limit the distance between yourself and other people, in addition to the general preventive measures that we tell people. Washing your hands, covering your cough, coughing into the crook of your elbow or into a tissue and disposing of that. These kind of preventive measures will go a long way. And finally, I'll just mention to you in your line of work, or in the line of work of those folks that are listening or watching, unprecedented efforts have been undertaken in trying to clean those community areas. So just like we witnessed in the cruise industry when norovirus came out, and you have people constantly cleaning the handrails, elevator buttons, door handles, those kind of same measures we should undertake, or would be the advice that I would give you to undertake, because it's the same advice that we're doing here in the hospital in our community areas.
Terrific. So this coronavirus has certainly gotten a lot of attention, and at a statewide level, because our governor has declared Florida under a state of emergency. So if I could ask Donna, what does that actually mean to be under a state of emergency, and how long can that last?
Well, Tim, a state of emergency can last as long as the circumstances warrant it. So we could be looking at being under the state of emergency for many months to come. In addition to the state of emergency that Governor DeSantis declared on March 11th, we have a national state of emergency, and many of the counties in Florida, particularly the counties we're sitting in, have also declared states of emergency at the county level. Some cities have declared states of emergency. So I think what we're telling our boards and our managers is we need to take our cues from people at the national and state levels. They are taking this crisis very seriously, and our boards need to start taking it seriously too. You know, our boards have a general duty to maintain the premises in a safe condition and in good repair. And they have to take the steps that reasonably prudent people would do under similar circumstances. In terms of the statutory emergency powers, there are statutory emergency powers that came into play a few years ago, and those were really the result of the problems we see down here in Florida with regard to hurricanes. So we've got those powers in 718, 719, and 720, and the division has now confirmed that those powers do come into play. And I know we're going to talk a little bit about how boards can use those powers to cancel or postpone meetings, declare certain of the common areas off limits, no longer for visitation, perhaps even limit guest visitation into the community. There's a lot that can be done as a result of those statutory emergency powers coming into play.
So Donna, that's a great point, because I got a lot of questions from some of the people that are on this call today, and their question really surrounds board meetings. We've got annual elections coming up. Can we cancel those annual elections right now? And if we were to go forward with an election, how does the voting work? If we have to have volunteers counting, do we have to allow owners in? Can we just have the attorney and a few volunteers count with an affidavit? Like, how do we handle that?
Yeah, great questions. Let's start with the easy part, board meetings. So as we all know in this industry, board meetings are not as well attended as the annual meetings and elections. So board meetings, maybe you can postpone that meeting if there's really nothing going on, but I think we're in the midst of a pandemic, so there are some things going on. We're urging our boards to use technology, whether they use an in-house cable channel, they can use this type of technology that we're all speaking on right now, but we have to discourage people from gathering. Some communities do not have large enough rooms to enforce the social distancing that Dr. Lenkus referenced. In those communities, they've got a couple choices. They can move the meeting outdoors, and we can space people out to enforce social distancing, or we can tell people, look, we're gonna broadcast this. You can join us on Zoom or a GoToMeeting app. That's for the board meetings. Now, for the annual membership meetings, the important thing is the election, right? Maybe right now they don't need to do the annual meeting portion, but I am not encouraging clients to cancel elections. Some members of the community are going to look at that as an attempt by a board of directors to remain in control. And we know that. We know the criticism that they're likely to get. So there's a couple ways you can do that. Number one, tell your members, your voting members, to drop off their ballots or mail them in. Do not plan on showing up to a meeting with the ballots. You can even make appointments. We're going to talk later about how you should manage the association office. The open door policy should be a thing of the past. So perhaps make an appointment to come and drop off your ballot one by one. Mail it in. We've got some clients, Tim, that are actually going to be videotaping the counting of the ballots. They're just going to have just a very few number of people in a room, 10 or fewer. Some buildings are using representatives from each floor or each building, saying send one person to sit and watch the ballots being opened. And we're also recommending that the counting committee and or the manager use protective gloves when opening and handling these materials. And this may be a question for Dr. Lenkus, but how long can that virus live on voting materials?
Dr. Lenkus, you want to handle that question?
Yeah, it really depends on the material. There is some data that is coming out that shows the duration of time that something lives on cardboard, let's say, versus steel. So not sure exactly how those voting materials are handled. Certainly, if the box is amenable to being wiped down, it should be wiped down. And those people that are handling it, getting it on your hands is one thing. You can wash your hands or you can use hand sanitizer, but touching something that's infected and then touching your face, your eyes, your nose, or your mouth is going to wind up getting you infected. So perhaps as they bring in the box or whatever that device is into the room to be counted and open it, before they do anything else, they should go and they should wash their hands. The material, the virus itself that lives on, let's say, a paper ballot that may have been cast over a week-long period is unlikely to still be infected if somebody had touched that. But certainly, anytime that they handle any material to protect themselves, it's best to wash their hands. And I'll just end with one thing to your point, and that is that some people put gloves on and they think that they're protecting themselves with the glove, but many people don't realize that if they didn't wash your hands before you use the glove or after you take the glove off, it's no different than not using the glove at all.
Okay, that's good advice. And one thing I do want to point out, we're asking Donna a lot of questions about not necessarily legal things, but this is a best practices conversation. So Donna is not rendering legal advice today. Although I do want to know where you're sitting, Donna, because I haven't seen the water move yet, but it looks like you might be in Italy.
It didn't escape my attention when we were setting up, Tim, that I'm speaking to you in my house. I'm in front of one of my favorite pictures, which is the Grand Canal in Venice. And that did not escape my attention. What we saw happen in Italy and the news we continue to get from Italy really should inform some of the measures we're taking here. This has to be taken seriously. There's no reason to panic, but certainly we need to act. And I'm sure that you and Catalina are going to report that we are seeing differing reactions from our boards. Some are underreacting and some are overreacting. And the goal here is to kind of get them in the middle.
Exactly. So while we're on some of the emergency procedures that are in place, Catalina, we know that just today Miami-Dade released their emergency order for essential services. So how does that impact what KW Property Management provides as far as the services to our customers, and how do we react to the emergency orders?
So Tim, great question, because we did receive that and our in-house legal counsel reviewed that message that we received from Miami-Dade County. And at the present moment, it doesn't impact our business. We continue reporting to work. We are considered essential. We are in the homes of all of our residents, taking care of the situation. So for us, it's business as usual and continuing to handle the situation.
And Catalina, what's been the impact on our staff coming to work every day? Are people fearful to come to work? Are they glad to have a job and come to work with the economy getting so tough? Like, what are we seeing from a practical point of view?
Yes, so obviously we have asked our employees that are feeling sick to stay home. We don't want them to come to work in those types of conditions. So that's number one. And those employees that are not feeling well are abiding by that. And with regards to the rest of the workforce, they're all super engaged right now, very motivated to come to work and to continue to provide our services. We are extremely lucky. Our employees have a job, and we're coming to do our job in the best way possible, especially under these conditions. Situations have changed in our properties. I'm sure our employees are used to their regular routines, and those types of routines have now changed. A housekeeper that may be used to cleaning the gym or cleaning the amenities and so on may have to shift her focus now to other areas or where she may not be used to cleaning. So those are some of the adaptation techniques that we're going under right now, but our employees are, like I said, very engaged and very motivated to continue to do their job.
And I know at KW, we've also done a lot of cross-training amongst our employees because we just don't know who's going to be able to come to work one day. So someone that works at the front desk might have to learn how to clean something or be part of the maintenance team and vice versa, because it's important that we continue to service the communities. We have to keep air conditioners working. We have to keep generators working. Those are some of the basics. That's why I'm sure Miami-Dade County considers us to be an essential service, which we're certainly pleased with, just like I'm sure Dr. Lynch's feels that the hospital is certainly an essential service, and we need him, and our customers need us. Just to that point, if someone does get infected, Dr. Lynch's, what's an appropriate amount of time for an infected person to be self-quarantined?
So if a person is infected, if they've tested positive for COVID-19, then they should self-isolate. Self-isolation is a little different than self-quarantine. Quarantine is I was exposed to someone and I may or may not be infected. That just means I need to stay away from other people and stay in my house. Self-isolate means even within your house, you should stay away from other household members. That means you're in a different room from everyone else, and everything that you touch needs to be obviously washed down, and you need to take precautions yourself. You should put a mask on so you're not infecting other people. The CDC has wonderful guidelines that talk about when that isolation can stop. Generally speaking, you have to be completely symptom-free for at least 72 hours without using any medication, and the time has to be at least 7 days from when those symptoms started. So if your symptoms started today and you felt better on Saturday, 7 days have not elapsed. So it's 7 days from the symptom onset until they stop, and then at least, and then 3 days of being symptom-free before you can be out.
And then once you're symptom-free, do you have to get retested to prove that you're symptom-free, or do you know that time has healed you?
Yeah, no, you don't have to be, there is a way that you can get tested. And in that case, those people that want to get tested, they have to be symptom-free. You have to have 2 negative tests at least 24 hours apart. So 2 different samples that have to be tested. And if they're both negative, then you're allowed out of isolation. So you have a time-based relinquishment of isolation and a testing-based process to get out of isolation.
So you mentioned that it's okay to be outside and try to get some fresh air even during these times where you have to be cautious. But a couple of the questions that we got from owners are consistent, where they're saying, if we're practicing social distancing, is it still okay to go to the pool? Will the chlorine in the water kill the germs and we can still jump in the water? Is that reasonable?
Well, I don't know about chlorine's effect on aerosolized virus. I'm not sure that has specifically been tested. I don't know many people that sneeze underwater, but I think having some distance away from other people, and certainly if you are at the pool area and there is somebody that's also at the pool area and they're sick, or you hear them sneezing, you want to get away from that person probably as quickly as possible, and you don't want to be near them, because we do know that 6-foot number comes from how far a sneeze is and how big the particles are that can infect you. So I think that it's important to get outside. There's some talk about whether being outside is good to kill the virus, which is very helpful, although we will wait and see what happens as the temperature gets warmer. but I think it's just a matter of not congregating together in a common area and having those same social distances.
And just so you understand, Doctor, at your office's advice, we're practicing social distancing right now. We were all going to get in an office. Donna was going to allow us to use her office space, and your office said we should show the same level of courtesy that everyone else is. So we're all sitting in 4 different places throughout the city having this conversation today. So thanks to technology in your office.
Yeah, I totally commend you for that. In fact, somebody sent me an interesting message. They said, you know, now we're going to find out how many face-to-face meetings can be done in other ways.
Yes, it's changing the way we all operate. What about elevators? And you get into a building that's got elevators, that's a very confined space. Like, how unhealthy a place is that? What can be done on an elevator?
Well, a good question. You know, certainly if the elevator is packed, I don't think that I'm going to walk into the elevator. Remember, this virus can affect everybody, but the people that are most prone to severe diseases are people that have a lower immune status or people that have a lot of medical conditions. So I think that to the extent that maybe not taking the elevator from the first floor to the second floor, maybe taking the stairs would be better for you. I think that that's better health-wise, and it also keeps you out of an elevator, which is a confined environment. Now, you can't, if you're already in an elevator, you're not going to know when the elevator opens up on multiple floors who else is getting in there. Touching the elevator buttons, hopefully as property managers, there's additional cleaning that's going on for those kind of common areas. When a person exits the elevator, they should be washing their hands or using hand sanitizer if they can. It's really prolonged close contact within that 6-foot radius. So if people are getting on the elevator and people don't feel comfortable doing it, let them get off the elevator, wait for the next one.
Right, or take the stairs.
Or take the stairs.
Tim,
So-
and if I could just add to that, some of our properties, that's exactly what we're practicing, where it's only one resident at that time that goes up in the elevator. So we are following those procedures, and also the sanitizing of the buttons in the elevator, and in those properties where we can do that from the front desk, where we can allow a resident to go to their floor, we're also using that software as well.
So that means it's hands-free. We don't need owners punching buttons in elevators and then sanitizing each time the elevator gets used. Great.
Correct.
So what if, Doctor, another question for you. If an owner or resident is positive with the virus, does that mean the building should be on shutdown and all the employees should go home? Or what's the real concern about contagion?
I think it kind of depends, because you have employees and you have residents. Frankly, at this point, if you're over the age of 65 and you have medical conditions, you really shouldn't be going out to the grocery store. You shouldn't be putting yourself at risk. You shouldn't be going out in communal areas. So, I mean, I hate to sound sort of alarmist in locking down our elderly population, but the limitations on them should be pretty strict in an effort to try to keep them healthy. There are other people that could deliver their food and whatnot. If one of those people gets sick, then it is even more compounded that they should be removed so that they don't get anyone else sick. If an employee gets sick, like Catalina was saying before, I think we practice the same thing even here in the hospital. If you are sick, do not go to work. Stay home. Frankly, it doesn't matter whether you have coronavirus or you have some other virus. If you're sick, you do not want to spread that to other people. So I think those are probably the most important things. Does the whole place need to be shut down? No, the place doesn't need to be shut down. People that come in intimate contact with that individual, you would want them to monitor themselves for symptoms. They could call their primary care doctor and let them know, by the way, my friend who I always play pool with, he tested positive, and let their primary care physician guide the opportunity whether to test, whether to self-monitor and not impose any restrictions on them, or whether to impose that self-quarantine.
Terrific. Yes.
Tim, I'd like to circle back to the pools, if we could.
Please.
So for the pools, it is my strong recommendation that the pools be closed. I understand the need to get out and get fresh air and sunshine, But in our multifamily buildings, you have hundreds of residents. Some of those residents have guests. There is just no way in most instances to limit a gathering of less than 10 people at a pool in a high-rise building. And also down the road, I don't know how you're going to make the argument that you're distinguishing between between closing some of the common areas and not all of the common areas. And it's not just about swimming in the pool. I know I get that question too. Is it healthy? Will the chlorine kill it? It's about all those surfaces people are touching at the pool furniture, the towels, if the association provides towels. It also sometimes provides a false sense of security. So people are thinking, okay, the gym was shut down. That's a risk, but the pool is still open, so it must not be a risk. And I know some building staff are going out there and they're cleaning up, but again, we have to strike the right balance here. We want boards to safeguard the security and minimize the risks to residents, but we also don't want them acquiring additional liability they don't need to. If you keep the pool open and people are relying on the board and building staff to go out there and clean up, they would be cleaning up after every person. They'd have to see who has sat in which chair, which towel. There would have to be a lot of different protocols put in. And frankly, I don't see the benefit to it. I don't see the benefit or upside in keeping a pool open. And with regard to elevators, all of this can become part of a COVID-19 disaster plan. To Catalina's point, we are recommending that you post notices, that you observe social distancing in the corridors, that you observe it in the elevators, and limit the number of people. If there's 2 people, most elevators can safely accommodate 2 people, but not more. So you wait for the next elevator car, and perhaps you give priority to your handicapped residents.
So I want to circle back on access to different properties and who should have access, Donna, but I want to go to Catalina first. And Catalina, we're dealing with this every day. We've got hundreds of properties that we've created protocol for. What are we seeing most boards doing as far as making decisions around pools and other amenities, opening, closing? How are we handling that?
Right. So our board members have definitely been very proactive, and I do want to take this opportunity to say thank you to all of our board members that have been working very hard. I know as of Sunday, we had properties already hosting some emergency board meetings to address this specific point, which is the closing of the amenities. And I have to report, Tim, for the most part, everybody is being very conservative. They want to close as many amenities as possible at all of our communities. Some of the amenities are being left open, but again, we're limiting the access to those amenities. I do send out a report. So for all of our attendees today, I am sending out a daily report that indicates all of the amenities and the closure of those amenities. So pretty much the status of where we're at as it relates to all of our properties. But that's pretty much where we stand. A lot of the gyms have been closed. A lot of the pools have been closed. Meeting rooms have been closed. Kids' rooms have been closed. Club rooms, club offices have been closed. So everybody is taking a lot of precaution with this. And I think we're all trying to do the same thing, which is to stop the spread of this virus. Did we lose Tim?
Uh-oh. Tim. So Catalina, can you hear me? This is Donna.
I can hear you perfectly, Donna.
Okay. So are you finding that in some communities, they've closed everything down but kept the pool open? Because that's what I'm finding, that's kind of like the last holdout. And I understand the motivation because it's outside.
That's exactly what is happening at most of our communities. They're closing most of the amenities and leaving the pool open. I have seen a lot more pool closures today, but that's what the trend is and what's happening with most of our properties.
And one option may be to remove chairs, just to take some of the lounge chairs away and space them out, or to use an advanced registration system for the pool.
So we have been practicing the distancing of the chairs.
Mhm.
We are setting them up in that manner to, again, practice the social distancing, and that's really what we've put in place.
Yeah, that's very smart. Do you have any buildings with shared laundry facilities?
So we do have one building that has the shared laundry facilities, and they are keeping that area clean, open, I should say, and limiting the access of people inside the laundry room.
And as this continues to evolve, I just had a request in a community. They are a 12-story building with shared laundry on every floor. We have some very vulnerable residents with underlying health issues. And we had several residents say, look, I just don't feel comfortable using the shared laundry facility. Could we, as a reasonable accommodation, install a washer and dryer in our unit? And I'm inclined to say, yes, that may be something that should be permitted in the interim until this crisis passes.
We haven't had that situation, but I think that sounds like a viable solution given the circumstances.
You know,
So
there you are.
Donna, I sneezed and I think I lost I lost everybody. So now I'm back.
You self-quarantine for
Yeah,
a
it
few minutes.
takes a minute to get your Wi-Fi back working once you sneeze. I know that for a fact. So, Donna, I do want to address a lot of the issues that we have around meetings and who can be allowed onto a property, who has access to property, who can we limit from coming onto a property? Because, you know, in a typical day, we've got management team coming in. That's essential services. We've got housekeepers that come in. We have nurses that come in, critical care nurses that come in. We have contractors that come in, vendors, all different kinds of vendors that come on property. Who can be limited from coming in, or can anybody be limited because it's their property?
Yeah. So certainly you can start limiting people from coming to the community, because as Dr. Lynch said at the outset, the greater the exposure, the greater the risk. So let's talk about who's essential. Certainly caretakers are essential. If you have people coming in to take care of vulnerable or ill residents, then absolutely. Immediate family member as well. I would say we're not at the point where we've got a nursing home situation where even immediate family members cannot come in and visit their family members living in your building. There are people with the legal right to access to the community, and those would be a census taker, although hopefully that's not happening right now, and process servers. But what we're telling our communities is it's entirely reasonable for you to, if you can, acquire some protective gear for the people who have a legal right to access the property. You also want to continue to permit delivery people to come into the property, because you're going to have more and more people ordering in food as their choices for, you know, restaurant options and other entertainment are being reduced or completely eliminated. You're going to see more and more people staying home, working from home, and ordering in more and more supplies. So you don't want to shut off anybody who's going to be delivering food, pharmaceuticals, or other important options right now. Now, do you need people ordering in heavy furniture where you have several people coming into the building to move in that furniture? Probably not. All the non-essential guests can be eliminated at this point. And that takes us back to the emergency powers that we talked about, Tim, at the outset, which is under those emergency powers, the board can declare the property off limits if they deem it necessary and upon the advice of emergency management professionals, which our emergency management has already told us this is a pandemic and the only way to flatten the curve is to minimize exposure. So when it comes to contractors right now, most of my communities are shutting down construction projects inside the units, and they're shutting down their own construction projects. Now, there are exceptions to that. If there are emergency repairs that need to be made in terms of floods, leaks, appliances that need to be replaced, you need a refrigerator, we're allowing that to happen. And it's the same thing with essential emergency association projects. But other things like renovating your powder room is not a necessity right now when we're in the midst of this global pandemic. Other social guests like friends, you're going to see people in the coming weeks, particularly if we have to continue to basically shelter at home, want to have parties, want to have social guests into the community. That's not advisable right now. So every board needs to speak to legal counsel and discuss amongst themselves how tight they want this policy to be. With the deliveries, it's important to come up with a delivery protocol. Do you want to, right now, in the past, when people were delivering, they may have gone directly to the door to deliver food and items. Perhaps that's no longer a good idea, and you want to have those deliveries confined to the front desk unless the person who has ordered the items is confined. And then in that case, you need a different mode of delivery.
So Catalina, again, from a best practices practical point of view, how are we handling those types of issues with people coming into the property and delivering packages and food?
So we are addressing those types of situations through our board meetings that we're hosting, and we are limiting the number of guests that are coming to our communities. We are limiting the vendors as well. So as Donna was mentioning, really focusing only on emergency repairs. And that's what we're practicing as it relates to the deliveries. So yes, there's a lot of food delivery during this time. And what we're trying to really do here is manage that process to protect our employees and protect the residents. So the deliveries are coming to, depending on the property, of course, but I'll use the high rise as an example. They're coming to the front desk, and then the resident, if they're not quarantined, they're coming downstairs to pick up their delivery. So we are managing all of that at all of our locations.
Okay. And doctor, what kind of extra measures are you taking at your hospital to kind of lock down things as far as guests coming in? And you really operate much like a condominium. You're in a large building with multiple floors and a lot of amenities. What are you doing from a hospital standpoint?
Well, many of the same things that both Donna and Catalina have mentioned. Obviously, we've stepped up our cleaning measures in the public and common areas. Some of the eateries that we have here on site have either closed or have closed to in-restaurant dining and are available for pickup and takeout. Do we have added security around the facility to limit the number of visitors that come here? And we, like other institutions, are imposing a pretty strict visitation limitations on the building, because anybody that walks in actually is screened, including not just visitors, but including staff. I mean, I myself had my temperature checked this morning before being able to walk in the building. So we have these containment measures, if you will, in an effort to try to minimize the number of people that are entering the building and the number of people that are wandering around the building that aren't absolutely essential.
So Catalina, does that sound like managing a condominium?
It does. I don't know about the temperature checking, though. We haven't gotten to that point yet.
But that's not a bad idea.
Exactly.
So we got all these amenities that we have to all deal with. Donna, what can a board close certain elements of the association without an open meeting? What's the proper way for a board to say pools, kids rooms, clubhouses, billiard room, card rooms, restaurants we're shutting down? Do you have to get any approval to do that?
Yeah, listen, the boards have to continue to operate and administer these communities, and having board meetings is a big part of that. So we're still recommending that boards make these decisions at a duly noticed board meeting. Now, having people attend those meetings is another thing. At this point, given where we are in the midst of this crisis, it's not advisable to have your members packed into a room, listening to you, saying how you're shutting down common areas because you don't want them packed in a room. So it would be much smarter to say, this is what we're going to do. Notice the meeting, explore the different opportunities for technology. As you know, right now in Florida, board members are not supposed to be taking votes by email, but our emergency powers have kicked in. So the way to go about this is, you've got to create this COVID-19 plan pursuant to the Condominium Act. Post a meeting, give them options to attend. If nobody can take you up on that option, why not have somebody in the corner videotape the meeting and then blast it out to everybody afterwards? Here's the thing, Tim, you're still going to want to be a source. The board and management professionals are going to want to be a source of information and calm for the residents. And the way to do that is more information, not less. That's why it's important to continue to hold these meetings, to continue to establish official communication channels where people know where they can get this information. So pick one of your channels, whether it's a text or an email chain or your Facebook page or preferably your website, and tell them this is where all of our official information regarding COVID-19 is going to be posted. And for the meetings, when you have to take those meetings to say we're shutting down the following things, videotape it. If you can't set up a meeting like what the four of us are talking on right now, then at the very least you can videotape it and get that out. And as you know, many of the communities you manage at KW, I'm sure they have in-house cable channels. So that's another great way to broadcast the meeting without having anybody physically sitting there.
So Catalina, what are we seeing as far as the primary means of communication inside most buildings?
Yeah, so in most of our buildings, they're using definitely the virtual approach when hosting these board meetings, through conference call. And that's really what we're seeing at our communities when they're hosting these board meetings, is using both the conference or the virtual choices.
Okay, and so there's also a lot of questions around liability, Donna. If I've got a project that I'm in the middle of, and you come to me as KW comes to you and says you have to shut down your project because we can't have these contractors wandering the building, and what's the liability factor for the association? Can they be held liable for disrupting a project that could end up costing more money?
I think arguably, Tim, that they will have more potential liability if they don't shut down the project than if they do. So if a director exhibits disregard for safety. So you have to ask yourself, would it be construed to be either negligent or a reckless disregard if you allow somebody to continue with a whole unit which requires numerous contractors to be combing through the building in the midst of a pandemic when everywhere around us things are shutting down? Liability, director liability, if you exhibit reckless disregard for the safety of your residents. In terms of having contractual liability for an owner who's in the midst of a project and says, hey, I'm going to get hit with overcharges or perhaps a specific performance claim or breach of contract from a contractor, that would be a lawsuit against the association, not individual directors. So you have to look at that first. But secondly, those owners arguably have an impossibility of performance argument under their contract because their response to the contractor is, hey, I can't allow this to go forward because the board has shut this down. It's not that owner who's willfully saying, I'm not going to move forward. Their argument is, it's an impossibility of performance argument. The board has shut this down. Now, many of those contracts might hopefully have force majeure clauses in them, and hopefully they are mutual force majeure clauses that take into account work stoppages due to the typical language is unforeseen circumstances that could not have been contemplated by either party, acts of God, or natural disasters. I would say moving forward, we are going to learn so many lessons from the terrible months ahead that when we start drafting contracts next year and the years beyond that, I think we will revisit many of our contractual provisions. And I can tell you, I certainly will add epidemics and pandemics and quarantines into my force majeure clauses.
And it's a good point that you make, Donna, for advice as far as, especially if you've got a project and you've got an owner's rep who is billing you on a monthly basis and you shut down, it really is important to look at the contract to see if you're allowed to get out of that cost for the period of time that you're shut down before they come back on site. At least have that conversation with your owner's rep.
Absolutely. And you know, these are temporary because this may be something that we can revisit in a couple weeks. And I would tell for the contractors who want to continue to do business, hopefully they're going to work with people and understand this is for the protection of their workers as well.
Absolutely. So what if our workers aren't comfortable coming to work? anymore. What are we doing, Catalina, if an employee chooses not to come to work from fear of catching the virus? Does that person have to be paid? What are the options that we have as a management company in dealing with those employees?
So thankfully, we don't have that situation going on internally. I think our employees are very happy to report to work. I think they feel safe in the environments that we've provided to them, meaning the managers have really, really worked hard in making sure that our employees feel comfortable coming to work, meaning they have enough sanitary supplies that our employees can use those supplies to keep their hands clean. Also providing them with gloves. I think that was one of the main concerns initially with our employees, is they are touching these surfaces. And so we wanted to make sure that they feel comfortable, and we are providing those gloves, we're providing the hand sanitizing, and all of that, all of those precautionary measures, I believe, have really made our employees feel comfortable coming to work. And that's pretty much where we're at right now. If an employee, like I said, is not feeling well, or under the circumstances that we currently have in place where the schools are closed and they cannot report to work, we are getting creative. We're giving them some rotating schedules, and if during the day they have to stay home, they're staying home and coming during other hours where they can actually come to work and perform their jobs and responsibilities. So I think it's a message of where this is all new to all of us. Our employees want to work, and we want to make sure that their environment is safe and that they can come to work every day.
So, Doctor, one of the things a couple of times this question came up from the audience today is, if we have somebody that becomes sick, what's the responsible thing inside a community as far as reporting that? Do you think we're required to report it? What does Hipaa laws say as far as protecting a resident that actually is sick?
Well, you bring up a couple of points. I mean, the federal government has suspended Hipaa from healthcare workers, so we are able to now communicate with people in unprecedented ways that we were not able to do before, specifically to avoid that personal interaction that we've been advised to do. I think with respect to reporting, the positive COVID-19 is reportable to the Department of Health. So if you go through any of these drive-through testing, or you get a test done by either the department or a commercial vendor, any positive test does get reported back to the Department of Health, because it is a communicable disease that is reportable. The responsibility, Donna's on the line here. She can probably answer that better than I, but I don't know that you have a particular responsibility in order to report it, because you're not the person testing and you're not the healthcare worker.
Donna.
Tim. So typically associations are not considered to be a covered entity under HIPAA, but there are wrinkles with that depending on how you got the information. So if the most credible information we have when it comes to an infection or exposure is self-reporting. Somebody comes to the board or the manager and says, hey, I've been exposed to this illness, or I've tested positive. At that point, you can ask that person, are we okay with letting people know? Sometimes, believe it or not, the person is okay. And I had a board member that tested positive and wanted to set an example for the community. And I thought it was an excellent way to encourage other people to self-report, for that board member to say, I've tested positive, I'm going to be quarantining in my unit, and I encourage other people to do this so we can, get through this together. I thought that was an excellent example of leadership on that board member's part. In terms of HIPAA, again, associations are not typically considered covered entities who are handling medical reports. But if the association has a direct employee and they got that information as a result of insuring that employee, then yeah, HIPAA may apply. You need to talk to association counsel about the particular circumstances of how you learned the information and from whom. But I do think that if you have an active infection or quarantine situation in your community, the association should disclose that without naming names. So we have an active infection in the community, all possible and necessary safety protocols are being followed, and certainly reach out to the Florida Department of Health call them in, get information from them. You know, we should be having information posted throughout the community with CDC guidelines and with information on how people who are feeling ill can contact the Florida Department of Health.
And so, Catalina, from a practical point of view, what are we doing to make sure that an owner or resident is taking the responsible tact here and actually self-reporting, making sure that we all know what we can do and what they can do to help protect themselves in quarantine?
So we are also seeing a lot of our residents self-reporting. They are calling the management office and saying, I was with somebody that was exposed to somebody that has contracted the virus, so I'm going to self-quarantine. And, you know, we, at that moment, obviously want them to go ahead and do that. We'll take some precautionary measures and make sure that we enhance the cleaning and the sanitizing of all the common areas. But we are seeing a lot of self-reporting from our residents, and as it relates to even asking some questions. So when we do have residents coming in from other countries, maybe countries that have been listed as level 3 countries per the CDC, where the recommendation is to self-quarantine, what we're doing with that is educating the residents. So I think this has been also a time period of a lot of education, and a lot of our managers, through their daily communication or every other day communication to the residents, is informing them of all of these precautionary measures that we need them to take in order to stop and prevent the spread of this virus.
So Don, a couple other questions that have come in. One of the questions came from an HOA and says, is it legal to close the amenities? And then we've got owners that are asking for their maintenance fees to be prorated because they can't use their pool. So what would you say to a board? What would you say from a legal perspective on that?
Okay, so I would say if you are watching this webinar, please take away this information that yes, it is legal under these circumstances for your board to shut down the common areas to reduce the risk of COVID-19 spread. Without a question, they can shut things down. With regard to asking for your money back because of usage, Tim, that kind of reminds me of the person who says, I don't swim, so can I get a reduction on my assessment that covers the pool? The answer is, quite frankly, that these are temporary closures, and there have really been no costs that have been reduced or eliminated when it comes to maintaining those areas, okay? You still have to pay to insure those areas, you still have to maintain them, and quite frankly, as I'm sure you and Catalina can address, what's happening is you're still expending the same, if not more energy, just doing other things, like the heightened sanitation throughout the lobby that you did not need to do prior to this, and all the other steps you're taking to ensure that the residents are safe. So the short answer to the individuals who are asking that their assessments be lowered for that reason, the answer is no. But I do think the question raises another interesting point on a going forward basis. So we've had some varying information about how long this crisis is going to last. At first we were told it might blow out of here by April. Now we're looking at July or August, and some experts are saying this is going to be cyclical, where we're going to see the virus die down and then come back up. It is without a doubt that people are going to be laid off. We heard what the job reports are going to look like, and they're not pretty. Some communities may want to look at perhaps taking into account that they could wind up having massive delinquencies in the coming months, exploring whether or not they want to reduce the assessments and get a membership vote to tap into reserves to cover some of the operational costs right now. And this is another example. I don't know how many of your communities are fully funded. I know there's a trend that there's more and more that are fully funding or at least partially funding their reserves. But this is another example of how communities that do have reserves can better weather these kind of storms.
Excellent. So we just have about 3 or 4 minutes left. So Don, I have one more question that came in to the chat line, and it asks, if we have a beach club and we've closed the beach, can we chain the door to keep people from getting onto the beach?
Probably not, because those doors tend to be fire doors. So before you take that drastic step, I would reach out to your local fire department and find out if that particular door is one that is needed to remain open for safety reasons. But shutting down the beaches makes sense. I have a lot of communities that also have private beach. And what's happening is, because now the public beaches are being closed, you've got residents that are inviting people over to their private beach to come party. So certainly you need to take steps to let your residents know that they can't be doing that. And in terms of anybody who's intruding on your beach, I think that's a question you might want to put forth to the local health department or even to the police department.
And as another option, if you have on-site staff, you could appoint somebody from the on-site staff, rotate them through to watch that door and make sure people don't come in and out. And that could be part of the measure to just eliminate access to the beach that way too. Or
And if you
might
have
to spend a
cabanas
little-
on the beach, take them off. If you've got nice lounge chairs and cabanas on the beach, remove them.
Right. Don't make it attractive to go out
Right.
there. So I'm going to ask all of you one more question. It's going to be the same question. I'll start with you, Dr. Lynches. What's next? What can we expect over the next week, month, 2 months? Where are we heading?
I think we're going to head toward more restrictions on our personal space. When you look around the country, you see that some cities have imposed shelter-in-place orders. I think that as we look at hotspots around the country, I would frankly be surprised if people, in an effort to try to get ahead of this, if city governments or even county governments didn't impose similar orders. I don't know that would make a lot of difference in terms of our everyday life, because there's many things that you would go out and do right now that you can't do anyway. So I think having people stay in place and ride out the next week and a half or so is probably not a bad idea to do, especially in areas that are experiencing this ramp up of infections.
Excellent. Now, and how are you doing at the hospital? Are you filled to the gills right now, or are you able to take care of all your patients pretty effectively before the virus?
Thankfully, we have space in our hospital to take care of those patients that need to come to the hospital. I stress that because patients that are sort of the walking wounded, those patients should not come to the hospital. This is not a hotel. This is not a place that people should be at if they absolutely do not need to be here. We have taken efforts in order to discharge patients out of the hospital who are well enough to do that, rather than keeping them here an extra day. The fact is that tomorrow is a relative unknown. So we have to be prepared to weather the storm of an onslaught of patients that may in fact need the healthcare resources that we have that are relatively finite. And the other thing that I'll mention is that we, like many hospitals around the country, are taking similar measures in an effort to try to streamline the operations. Many of us have already gone through surge capacity protocols in an effort to sort of play the what if game. What if we run out of beds? What if we run out of ventilators? Could we get more? Where could we put other people? There's a very well-established partnership between institutions like my own and the city, the county, the state, and the federal government in order to leverage resources. There are surpluses that have been built up over years. The federal government has taken to the airwaves every day to explain to other healthcare providers like myself what lies beyond this if our resources do in fact become scarce. And I think the fact is that we will see a spike in the number of cases. The question is going to be in the interpretation of that spike. Are these cases like you or I here, or the people that are watching that may not have tested positive but have no symptoms and are in fact infected, and once we get tested, then all of a sudden we move into the positive category, or are these really new cases? And I think that's the relative unknown, because when we look at how deadly this disease is, how rampant it is in its infectivity, these are numbers that frankly we don't know today.
Thank you. So Donna, from the legal perspective and what you're dealing with your clients, I'm sure the conversations you're having today are different from 6 weeks ago. What's ahead for you?
Well, from a lifestyle aspect, Tim, you and Catalina know that we've got a few disgruntled people living in these communities who might be unhappy that we're having this webinar on a Thursday rather than a Tuesday. So I think we can expect in the coming weeks that we're going to have people whose nerves are frayed. They're seeing that their lifestyles have been impacted. They're paying maintenance, but they're not able to use any of the common areas, even though they're shut down for their own safety. So I think the boards have to be, and management professionals have to be prepared for tempers to be at an all-time high. I think that's where the protocols and policies will come in. If you have an open association office door policy, I would consider adding, closing that and making, people call or email when it comes to wanting to come and vent. Because if you're shut in, that may be the first place where people are headed, is to the association office to vent about stuff. In terms of potential liability, I am heartened that right now, every conversation I'm having with clients is about how do we protect our residents. I haven't had one conversation where a board has said, how do we minimize liability? And to me, that's the most important thing here. These boards are truly looking to safeguard their residents, but I think the residents need to join in the effort, okay? This is not a one-sided or unilateral effort. Residents have to cooperate. If the boards have shut down certain amenities, if the boards have instituted certain protocols regarding elevators or shared laundry facilities or heightened hygiene, the residents need to embrace those protocols to keep everyone safe, including the protocol to please self-report. I was happy to hear what Catalina reported, that many people are doing just that, self-reporting. Right now, we need to get through this medical crisis, this medical storm, if you wish. And guess what? In Florida, we're equally, doubly vulnerable, because guess what's coming up in 2 months? Hurricane season. So we get to go through this, on a two-sided front. Hopefully we can get COVID-19 tamped down before we have to deal with emergency plans. But this is certainly something for boards and management professionals to be dealing with legal counsel. How can we wrap and fold in COVID-19 protocol into our disaster planning protocol?
Great, thank you, Donna. And Catalina, from an on-site in the field perspective, what's next?
So just to add, before I dive into that, with regards to Donna's comment on hurricanes, I really hope they decide to be virtual as well. That was a little joke. But anyways, for us, what's next, right? So really always thinking ahead of what's coming and adapting to those changes. So that protocol that we've put in place throughout all of our properties, how do we need to adapt that, and really planning for that, and something that we're very much on top of. I think the continuation of educating our residents and really pushing that message of social distancing is a key for all of our property managers to continue to do. And then, yes, our amenities are closed. So how can we get creative? How can we continue to enhance the lifestyle of our residents? They're all home. They're home, and we need to get creative and come up with ways to keep them engaged during this time. So, for example, instituting some simple ideas such as cooking recipes and disseminating that throughout the entire community. Maybe doing some virtual fitness classes. And that's really what's next for us, is adapting ourselves to this virtual way of living. And we are here and we're ready to do that.
Well, and we certainly, where we were a week ago is very different from where we are today. And I'm sure from the medical profession, Dr. Lynch, that's very much the case as far as how quickly everyone has to adapt to the new news that we find out and the direction that we're all going in. So we all just want to be safe. That's where we want to be. We don't want to be sick. We don't want to end up becoming a patient of Dr. Lynch's, although I know he would take great care of us. So if I could wrap up, I just wanted to say that KW Property Management wanted to provide a service to all of our association board members, and not just the properties that we manage, but everybody in the state of Florida. We felt that a webinar was the best way to help guide you while respecting social distancing. So we will extend our service to all of you by offering a COVID-19 hotline. You will all receive a follow-up email after this call, and all 920 registrants will be sent an email that you can send your questions to us, and we will answer every question that comes into our COVID-19 hotline. You can also visit us online at kwpmc.com and review our COVID-19 frequently asked questions. So all these questions that come in, we'll put the answer out there so you can come in and look to see if your question is very similar, because we get the same question asked about 12 different ways. So you'll see that those answers are good for everybody. If you want to watch this broadcast again or share it with a fellow board member, we did attempt to record it today. We'll see if it worked, but we'll send you a link so that you can watch the recording on our Facebook page. And finally, KW Property Management will continue to offer webinars like this on a weekly basis. If you found today's broadcast helpful, please sign up again for next week's update. We will continue to talk COVID-19 and the association cure every Wednesday from 3 to 4 o'clock for as long as this is of interest to all of you. So I want to thank the more than 900 Florida residents that registered for today's call. And I want to sincerely thank our panelists, Dr. Joshua Lynchus, Chief Medical Officer of Broward Health, Donna Berger, renowned attorney and shareholder with Becker Law, and KWPMC's very own Catalina Cruz. You guys are all awesome today.
Thank you.
We will be back next week to share more great information on how to handle the repercussions of COVID-19 virus. From all of us at KW Property Management Consulting, stay healthy and respect social distancing.